In this picture of rotation, we note the contribution of the atlantoaxial joint and the lower cervical spine, with very little discussion of just noting the coupled motion that occurs. So let's start with the atlantoaxial complex. So if we note first that we're focusing on the atlas and the axis in those joints, the convex on convex joints we noted before, and not the occipital condyles with the atlas, because there's very little rotation between the occipital condyles and the atlas. So most of the rotation that occurs in the upper cervical spine, or the atlantoaxial joint, is between C1 and C2, and there's approximately 45 degrees, because it's ideally, if we look, it's a pivot joint between the dens and the anterior arch of C1 and the transverse ligament that kind of pushes the dens up against the anterior arch. And so it's a very nice pivot joint that allows for a lot of rotation of the head on the cervical spine. So if we look at the lower cervical spine, or the intracervical region from C2-3 to C7, we note that there's going to be a posterior slide on one side and an anterior slide on the opposite side. So if we look here in this example of right rotation, we are remembering also that the facet joints are angled 45 degrees. So if we have a posterior slide on one side, we're going to have associated with that posterior slide is going to be an inferior glide or slide, and if we have a superior or an anterior slide on the other side, because the facet joints are angled 45 degrees, we also have to have some upward slide. So essentially, in this case, the lower cervical spine would be rotating to the right, but the right facet joint would be moving inferior and posterior, and the left facet joint would be moving superior and anterior, and therefore what would be associated with this lower cervical movement would not just be rotation, but there would be some amount of side bending.